Hi, my name's Sarah. I'm one of the respiratory specialist nurses. I'm here to deliver the session today on symptom management. During this session, we're going to talk about how your lungs work and how some chronic lung diseases can impact this. We will focus on how some symptoms are common across different lung conditions. In the next session, we will talk about how to treat these symptoms, how the lungs work. The main role of the lungs is gas exchange, which is basically oxygen is breathed in and carbon dioxide is breathed out. When you breathe in, the ribs move up and out and the diaphragm tightens and flattens. This increases the space in the chest and sucks air into the lungs. Air fills the alveoli, which are small sacs, and oxygen transfers across thin walls into the bloodstream, where it is delivered to your organs and muscles. Carbon dioxide transfers into the alveoli from the bloodstream and is exhaled. When you breathe out, the rib muscles and diaphragm relax, reducing the space in the chest, causing the air pressure in the lungs to build so that air flows out. This is very much a passive process. We normally take 12 to 16 breaths per minute, but the breathing rate increases when you exercise or if you have a lung disease. Chronic lung diseases. The process of how the lungs work can be impaired due to the changes associated with chronic lung disease. Different lung diseases lead to different changes within the lungs. Often symptoms can be similar. Chronic obstructive pulmonary disease, or COPD, is an umbrella term for a group of conditions including chronic bronchitis, emphysema, and chronic asthma. The C stands for chronic, which means that it is a long-term condition and does not go away. The O stands for obstructive, which means that the airways are narrowed and it's harder to breathe out quickly and air can get trapped in your chest. P. This stands for pulmonary, which means that it affects your lungs. D. This stands for disease, meaning it is a medical condition. Patients with COPD can have problems with the air sacs, so there can be less surface area for the gaseous exchange to happen. Sometimes the air sacs lose their elasticity, which can lead to air trapping. COPD is where air can't get out of the lungs easily because the airflow is obstructed or narrowed. Patients can often have narrowing due to inflammation of the lining of the airways or due to mucus. Asthma. People with asthma can have sensitive airways which can become inflamed and tighten when they breathe in anything that triggers them. Sometimes the airway lining can become inflamed, which can cause a buildup of sputum. The difference between COPD and asthma is that usually the airway narrowing can be reversed in asthma, but with COPD there is a permanent and progressive narrowing. Idiopathic pulmonary fibrosis, or IPF. IPF is a lung condition that scars your lungs and makes it difficult to breathe. It's the most common type of pulmonary fibrosis. The I stands for idiopathic, which means there is no known cause. P stands for pulmonary, which affects the lungs. And the F stands for fibrosis, which means scar tissue within the lungs. Scarring of the lungs causes the lungs to become stiffer, like paper mache, so the more layers of scarring, the stiffer it gets. The lungs also lose elasticity, so they are less able to inflate to get to gas exchange. Often this can lead to breathlessness. Bronchiectasis. This is a condition in which the airways can be scarred and inflamed, often leading to increased volume of sputum. Airways can become widened and it can be difficult to clear them properly, which can lead to a buildup of sputum in the airways, which can become infected by bacteria. Common symptoms of these lung conditions. People with a chronic lung condition can often experience long-term symptoms related to their disease. Some symptoms include fatigue, breathlessness, cough, wheeze, sputum, as well as anxiety and depression. These will now be discussed in more detail. Breathlessness. Everyone feels out of breath sometimes. It is normal to get out of breath when you exert yourself. Breathlessness is often related to the underlying condition, but it can also be due to inactivity and weaker muscles. Knowing how to manage your own breathlessness can help. Breathlessness can be due to sputum retention, airway tightness, infection or inflammation, scarring, reduced lung volume, or sometimes reduced oxygen levels. Wheeze or chest tightness. A wheeze can be caused by bronchospasm. This is when the muscles in the airways tighten. Bronchodilators such as inhaled salbutamol act on relaxing the smooth muscle and can reduce the wheeze. Infection can increase the inflammation and sputum production in the airways and thus can increase a wheeze. Colder weather can worsen a wheeze also. Sputum. It can be common to have sputum due to your lung condition. it is important to know what is normal for you. For example, looking for changes in the colour, consistency and volume and seeking advice if this is different to your norm. If your sputum is green, then it is usually a sign of infection. Often, it can be difficult to clear your sputum. It is recommended that you do regular breathing exercises to assist with the airway clearance. Keeping well hydrated with drinks throughout the day can help. Small amounts of tea and coffee are okay, but these are diuretics and water and juice are often best. Some people are prescribed a medication called mucolytics, such as carbamazepine or Naxos. These can help by making the sputum looser and easier to expectorate. Clearing your sputum can be tiring, especially when you're unwell. It's also important to ensure that a sputum sample is sent if you're having recurring chest infections. Cough. It is important to know what is normal for you. Monitoring changes in your cough, such as productivity, colour and consistency, etc. If your symptoms change outside your normal, it is important to have a review with your GP. Some patients find that exertion, exercise or allergic triggers might induce a cough. Some people find that taking antihistamines can help. Sometimes in ILD you have a persistent dry cough. Patients find that Oromorph can help, or codeine linctus. Fatigue. Due to the increased effort and work of breathing, often people with chronic lung disease can feel fatigued. Sometimes it can be difficult to get good quality sleep, so this can impact energy and fatigue levels during the day. Sometimes anxiety can contribute to fatigue. Breathlessness management can help with understanding how to manage symptoms and thus reduce anxiety. There are other medical conditions which can impact fatigue, for example, heart failure, anemia, and also poor diet and nutrition. It is important to discuss with your GP if you have a change or new fatigue in symptoms. It can be useful to plan ahead to be able to manage fatigue. For example, planning, pacing and prioritising your activity levels. This will be discussed further in a separate education session. Conversations about the future are not always easy ones to have. It is good to think about your wishes and plans though, and it is important to talk about it with your family and the GP. Annual reviews. You should have an annual review with your practice nurse at the GP surgery. During this appointment, a management plan should be discussed, which will include a conversation about your medications, such as inhalers, including inhaler technique, as well as discussing how to recognise the signs of a flare-up or exacerbation of your lung condition. You will be offered the flu vaccination annually, as well as the one-off pneumonia vaccination. In the next session, we will talk about disease management, which will include information and advice on how to manage these symptoms associated with your lung condition.